The prostate gland is located beneath the bladder. When it gets bigger, it blocks the flow of urine through the penis. This can cause problems with urination. As men age, the prostate gland grows as a result of changes in hormonal balance. If you don't get treatment for it, an enlarged prostate can cause serious problems. Benign prostatic hyperplasia, an enlarged prostate, is the most common age-related health issue in elderly men. In fact, it's the most common neoplasia in humans worldwide. Prostate growth can cause frequent visits to the bathroom, difficulty controlling the urge to urinate, frequent nighttime urination that can affect proper sleep, slow urinary stream, difficulty emptying the bladder, pain with urination, and increased risk of urinary infection, all of which can lead to bladder and kidney damage. Prostate growth patterns in adult men can vary significantly. Some men grow old and have a prostate the size of a ping pong ball, while others grow old and have a prostate the size of a grapefruit. We are investigating why there is a differential growth pattern, small versus large, for different men. One molecule that is responsible for development and growth of the prostate is 5-alpha reductase type 2. Our laboratory is investigating how this molecule may affect the growth rate and growth pattern of the prostate gland. Our studies have shown that epigenetics, which are environmental or societal factors that cause changes in gene expression after birth, can regulate 5-alpha reductase 2. We hypothesize that this epigenetic regulation may account for the differential growth of the prostate in different men. When this gene 5-alpha reductase 2 is turned off, the man's prostate goes from an androgenic melia to an estrogenic melia. In other words, rather than expressing masculinizing hormones in the prostate, this epigenetic change causes the man's prostate to express feminizing hormones. We think that this change in expression from the masculinizing hormones to the feminizing hormones may be a central component in explaining differential growth of the prostate. If a man's prostate becomes enlarged to the point where he can't urinate, there are drugs called 5-alpha reductase inhibitors, or 5-ARIs, that are used to shrink men's prostates in the hopes of helping their urination. However, some patients are resistant to 5-ARIs. We believe that our research, which focuses on the epigenetic changes of 5-alpha reductase 2, can help identify men who are going to be resistant to these drugs before even beginning treatment. Knowing ahead of time who is going to respond to this medication and who is not can allow for more personalized care for each individual patient.